You've just heard a lot about colon cancer screening, and you may be wondering how to sort out your options. Let's review the recommended approaches and the factors that people use to help them decide what they want to do about screening. The first choice you need to make is whether you want to be tested at all. For some, getting tested helps them put their mind at rest.
The reason for being screened for colon cancer after the age of 50, one is peace of mind, two is as a preventive measure to catch it at an early stage so it can be cured.
A particular advantage of colon cancer screening for me is that by finding and removing polyps, I could reduce my risk of getting colon cancer in the first place. Particularly with that advantage, the risk and hassle was worth it for me.
However, some people feel that the chance of dying of colon cancer is low, and that for them, getting screened isn't worth the effort.
What are my chances of dying from colon cancer in my lifetime? The chance is very small. It's very, very small, and it doesn't go to zero if you get screened. What happens is that you get a small risk that gets cut in half, if that, and that small change is just not worth it to me.
We can't predict who will get colon cancer, and being screened may or may not help you personally. Some people who have had cancer found because of screening feel that getting tested has had a clear benefit for them.
I didn't think there was anything there, and lo and behold, look what happened. It was there. We went in and got it out of there before it did any damage.
At the same time, if you find you have colon cancer after being tested because of symptoms, the cancer may still be curable. But keep in mind that finding a cancer is not a guarantee that it can be cured. Colon cancer is usually slow growing, and if your life expectancy is reduced due to your age or a serious medical condition, then screening may no longer make sense for you. If you feel this may apply to you, talk with your doctor.
Making a decision about screening for colon cancer isn't a one-time thing. If someone decides that now, for whatever reason, isn't a good time to be screened, that's a decision they can come back to later and reconsider.
My opinions about getting screened for colon cancer have changed as I've gotten older because I know that the odds of getting colon cancer, as with many cancers, increases with age. So it's heightened my awareness of the need to be screened.
If you do decide to be tested, you can choose which test you prefer. The good news is that any of them, if done on the recommended schedule, can help prevent cancer or reduce the chance of death from cancer. Here are key points to bear in mind. When choosing a test, consider what's involved, how often it needs to be done, what prep is required, how much discomfort to expect, and the time it takes. Also consider possible risks of complications. And in some cases, there may be costs, including travel, medical expenses, and/or lost work.
Many patients prefer doing the stool test for blood because it's a fairly easy test to do. They can do it at home. There's no preparation involved. There's no discomfort involved with it. Some people don't like handling their stool, and it does need to be done every year.
All the tests other than the stool test for blood require that you clean out the bowel, usually with a powerful laxative or enema. Some people choose sigmoidoscopy. It takes less time than a colonoscopy, has fewer risks, requires no sedation or recovery time, and is normally done every 5 years. On the other hand, because no sedation is used, sigmoidoscopy may be uncomfortable. Some people prefer a colonoscopy. Sedation is used, so there's usually little or no pain, and the doctor can look at the entire colon. It's normally done every 10 years. Some people like the fact that in a colonoscopy, any growths that are found can be removed at the same time, but for most people, nothing is found, so it's not an issue. Colonoscopy requires the most intensive preparation, has the highest risks, takes the most time, and requires that you have someone to drive you home afterward. CT colography is the right choice for some. It has little risk, doesn't usually require sedation or recovery time, and it doesn't involve inserting a viewing device into the colon. It's normally done every 5 years. If you're like the large majority of people, your screening test will reveal no problem, and you need only repeat the test at the recommended interval. However, if you have any of the tests other than a colonoscopy and a growth or potential problem is detected, A colonoscopy is recommended as a follow-up. Usually this will be done on a different day, and any preparation you've done will need to be repeated at another time. It's up to you whether you want to be tested, and if so, which test to have. The decision really comes down to how you feel about the benefits and drawbacks of the various tests. You've already taken an important first step in learning about colon cancer and your choices.
I have no control over my destiny, but I plan to be an active participant on the team, the medical team, because I want to be informed and involved.
There are good reasons why you might choose any or none of the tests. Talk with your doctor and decide what's right for you.